serve as the Dean of the College of Health Sciences, and I just want to take a few moments to welcome you to this evening's presentation. This is actually the first in a series of lectures, but it's actually not a lecture, right? It's really a conversation and a discussion about some different topics in the area of healthcare. And so as you came in and you signed in at the front door, you probably noticed this flyer that was there. And so again, I would remind you to, if you didn't pick one of these up already, definitely pick one up on your way out. So there'll be conversations on healthcare, well-being, and prevention. And of course, a topic that is probably at the top of everybody's mind, maybe a little bit unfortunately, is the one of stress and anxiety. And health, and then how that impacts cardiovascular disease. And so we have some wonderful experts this evening that will be talking about these various topics. So the origin of these discussions and conversations and the beginning of designing all of this actually came from Beth Finkel, who is our Director of Employee Health and Well-Being at the University of Delaware. And again, as I said, the lecture series and the conversation pieces came out of some discussions with Beth about how we can work to really improve employee health and well-being at the university, but for our employees, but also add this information for our students so they have an opportunity to think about this. And then, of course, a really important piece of this is really reaching out as well to the public and the community. And one of the features really of the STAR campus that we've really been wanting to realize is the opportunity to really interact more with the community and have the community interact much more with us as a university. Because together we can really change the health outcomes for all of the people of Delaware. And so again, we're excited about this, and I would also tell you to keep your eye on what we're doing at the STAR campus, what we're doing in the College of Health Sciences, because we really want to actively engage with you in all of this. I want to also just mention to you, so this is talks about the series. So tonight is the first one. There will be another one December 5th, March 8th, April 26th, and then finally in July. So this will go throughout the year. We also will have other workshops, seminars open to the public, and all of that. So again, you could also leave your name at the front desk, so we make sure we have you on an email list so that we can send you, if you're interested in getting emails from us and information about what those events will be. The other thing that I wanted to bring attention to, again, I know we have a lot of students here, but hopefully we also have a lot of people from the public and from the community. But one of the things that we do for our students as well is to provide within the STAR campus some clinics where they can actually be training and learning how to be a part of the healthcare profession team. And so we have a primary care center that is run by nurse practitioners. We have a physical therapy clinic, which is run by our physical therapy department. And then we have a speech language hearing clinic, which is also run by our communication sciences and disorders program. And that is all under the College of Health Sciences. Those clinics are all open to the public. We accept insurance plans, and we accept private pay as well, and Medicare and Medicaid. It's fabulous healthcare. It really is healthcare at its best. In a lot of ways, I like to think about it as one-stop shopping. And so you can come in here and really get care in our clinics. You can also be a part of our research studies, and we're really excited to have you here. The other thing on this slide that you'll notice is one of the themes of what we work on, and again, it's the expertise of the college that we bring to this, is the fact that we have, and you go across the scale, exercise counseling, mental health services, care coordination, comprehensive care, health coaching. We have a certificate program, but again, that brings the delivery of those services to you. Nutritional counseling. We also have some specialty clinics that we do, a concussion clinic that we just started. We have a Parkinson's clinic that we run as well. We have a lot of stroke studies going on and specialties in that particular area within physical therapy. We have acute care, as I mentioned, some of the specialized disease clinics, and then complementary and integrative care. And then you see the clinics that are then emphasized there. So if you have questions about that, we will be here, so just come and see us. There is information and brochures close to the front desk as well. And then we always have the front desk that is manned by people that are a part of the college. You can walk in anytime, and someone can help you at that front desk and give you more information. So again, please feel comfortable, and we hope that you tell others and to come and see us and be a part of what we're doing here. So without further ado, I would like to introduce one of our newest members, I think, to the college, although that may not be true. And you may recognize her, Rita Landgraf, who is the former Cabinet Secretary for Health and Social Services. So what better way to connect to the community than to bring the person who connected with the community for over 9 years. And so we're really thrilled to have Rita as a professor of practice, and then she will be launching her new program, which is a partnership for healthy communities. And she can tell you, hopefully, about that if she has a few moments. So I think without further ado, Rita.
Thank you, Kathy. I just need the...
No, you can't.
Oh, okay. She's trying to get my anxiety up to see how the panel handles that for me. Good evening. We're really happy that you've joined us this evening. And for the people in the back, if you want to come up front, really it is a safe spot for you. I checked out the panel.
I showered.
And everything is, yes, everything is good. So, but if you feel like coming up, great, we would love to have you. If you're comfortable in the back, I hope you can see and participate in the interaction of this dialogue. As Dean Matt had indicated, we are happy that you are here. Really, we want to be able to have a conversation primarily and focus tonight on anxiety and stress and how that relates to the heart and to your overall health. And I think you are in for a real treat. We have a panel of experts that will not only bring their perspectives, but also the science behind it. And so we're going to start tonight with Dr. Michael Peterson, and you see his profile right here. I'm just going to give a little bit of his background and then turn it over to him to give you more from his perspective. But Dr. Peterson has extensive experience in health promotion, program and planning, implementation and evaluation, both in the corporate sector, government sector, and education sector. He is also an expert in behavioral research, health and media, and social marketing. So Dr. Peterson, I'm going to turn it over to you to give more of your focus and the wonderful research that you've done here, and I believe actually internationally.
Yeah. Well, thank you very much, Rita. I really appreciate the opportunity to be here. And to give you a little bit why they asked me to be here, they needed someone to sit here. That was the number one. No, I'm kidding. But the idea behind this is really my area of expertise that I worked with for a number of years, well over about 15 years, was working on workplace health and stress. And looking at the work environment specifically, I actually started in worksite health promotion, started a number of different programs across the country, worked in different programs in doing that. And one of the things I noticed as I went through is that just having the opportunity to exercise or eat right wasn't enough. And so I investigated a lot more things related to that. And what I found was that one of the things that we were often doing, we tended to treat people from the neck down. We never looked from the head up or the neck up. And I started to investigate that, and I started to look at what is it that really drives people. And you look at work. If you look at work, we spend how much time preparing for work? Well, you spend a whole time going K through 12, then 4 years of education, then you may go on to baccalaureate education, professional education, postdoctorate, whatever it might be. You do lots of things to get a job. And then you work your entire life, right? And then you spend most of your waking hours working. And then at the end of that, you retire and you think about all the things that you did and still want to work, Well, work is very much a part of what we are. It's a part of our lives, and it's what we do. It gives us purpose and meaning and things of that nature. Hence, it has a lot of value, and things of value tend to be things that will tend to stress us more. And so when we talk about stress, the issue that I started to look at, and I investigated a number of things that I did. I created my own tools to do this, and I found a lot of times that I had to work as a consultant and not as a professor because corporations would not allow me to do research on them because of the proprietary nature. They didn't want people to know about their companies. So I've done specific areas across the various United States and Canada, done some work in Argentina, and then also involved people in England and Canada in terms of these types of areas. But one of the things I was looking at both government agencies, large corporations, and small corporations, begin to say some things that really began to play out in terms of workplace stress, and specifically for tonight, how it relates to cardiovascular disease. And when you look at cardiovascular disease and you look at work has a tremendous value. It has a tremendous impact on us. And a couple of things that we look at in terms of what are those things about work. And I'm only going to give you a couple because I have 5 minutes, so I don't want to be too much on this, and I'll probably explain more as we go on. But the biggest issue is two things, and they're called imbalances. And one is what we call the demand control imbalance. And the demand control imbalance is that if you work and you have high demand and low control over that demand at work, that puts you at a greater risk for a stress response, which then could directly and indirectly to potential cardiovascular issues. The other thing is an effort-reward imbalance. You put out a specific amount of effort and you expect a commensurate amount of reward. And those things oftentimes aren't there. And when you have an effort-reward imbalance, it actually leads to feelings of being underappreciated or overworked, or feelings of that I don't matter here, I'm being taken advantage of, I feel abused, or whatever it might be. And so those things actually create additional feelings of distress and discomfort. So much so that science and evidence will increase your risk for cardiovascular disease by 2 to 3 times. Right? Literally, because if you put those two things together of an effort-reward imbalance and a demand control imbalance. So a lot of things that we talk about workplaces and jobs, and I tell my students, they said, when they look for work, I said, here are some of the elements you might want to look for when you're looking for a job, as to whether it will be a healthy job or whether it will be one that could be potentially, let's just say, unhealthy. Right? And so those types of things lead to that. In a study that we did for the state of Vermont, I can pick on Vermont because we actually looked at the entire state of Vermont. We had a nice sample of over 3,000. We found that this also raised issues of other things. For example, and I call it the unholy trinity, which is job satisfaction, anger, and depression. The three went together. And oftentimes when you have jobs that have this imbalances, right, it leads to issues of anxiety, it leads to issues of anger, and it leads to other issues of cardiovascular disease. And so when we start looking at interventions, we can look at things individually. We can talk about what you can do and what you can't do, what's within your control, what's not. But also a lot of what my work tended to do was working with the corporation and saying, or the organization or the management, and saying, here's things that you can do. I tell people, and I've told my students this many times, I said, good management is health promoting. If you have a good manager who understands the basic elements and good job design, your job is designed in a way that you can address these imbalances and create balance and the ability for your skills to match the demands that are placed upon you. You actually can create a healthy work environment, increase morale, increase productivity, increase health, and actually they will have, at the end of the day, more energy to do the things that we want them to do, like exercise or eat right or do other things. Because at the end of the day, if you are overly stressed, excuse me, I'm getting over a cold here, but if you're overly stressed, you're emotionally depleted, and at the end of the day when you leave, right, you don't want to do anything. A Scandinavian study actually came out and talked about when you actually can address those principles, people at the end of the day will go out and exercise more. They will go out and eat right more. They will pay more attention to their health. If they don't have that and they feel emotionally depleted at the end of the day, they will go home, they will go sit on the couch, they will get the clicker out, and they will go like this, and they will eat ice cream, right? Because it feels good, right? It's a good thing, it's sort of satisfying, and it deals with the pressure and the stress of the day. So that's about all I want to say. I think I talked my 5 minutes, so I just want to kind of give a quick introduction. But those are some of the talking points, and I'll turn it over to Rita.
Thank you, Dr. Peterson. I learned a lot in his talk. I neglected to tell you that you might be sitting on an index card, right? If you are, don't be embarrassed. We love physical activity here, so it's okay to stand up and sit down as many times as you want. But the index card is for you to write questions for our panel. So as you hear them talk, you might want to jot down a question, and we can extend that question to one of our panelists, or actually all three of our panelists. Or maybe you could ask that question to somebody in the audience that you might know, or whatever. But those cards are for you to write down your questions. And if you need more, there's seats empty up here that have the cards, and you're welcome to those as well. So now, next on our wonderful panel, we have Dr. Edwards. Welcome, Dr. Edwards. And you see his title here. I just want to give you a little bit of his background. And he leads our National Institute of Health funded Center of Biomedical Research Excellence in Cardiovascular Health here at the UD and our College of Health Sciences. And the goal of this center is to develop a sustainable research center that catalyzes cardiovascular health-related research and actually will strengthen the infrastructure for this type of research to continue here at the University of Delaware. Dr. Edwards.
Thank you. It's a pleasure to be here. I thanks the organizers for the invitation. I probably won't talk quite as long as Mike, but for those of us who've been at college meetings. So my background is in exercise physiology. So my initial training in the area was working in cardiac rehabilitation. So I was exposed to patients who had just experienced a cardiovascular event, and stress and anxiety was a big part of that. So that's kind of my background, and we've been interested here in understanding kind of the factors that affect increased cardiovascular risk. And we focus predominantly in my lab on the vascular system, or the blood vessels. So we've been studying the effects of dietary salt. We know that poor diet habits can affect cardiovascular risk, and in particular, we've been studying dietary salt. And we've interestingly shown that even if your blood pressure doesn't change, and many people believe that I can eat as much salt as I want as long as my blood pressure doesn't change. Well, we've found that that's not necessarily the case, that even if you are salt resistant or your blood pressure doesn't change, you do see an impairment in blood vessel function, which has been shown to increase cardiovascular risk. So that's kind of one of the things that we're trying to spearhead, is kind of you getting the idea out that dietary salt is not necessarily good for you, regardless of whether your blood pressure changes or not. And stress is something that alters what you eat, right? So not necessarily just ice cream in a stressful condition, but potato chips and other things that may be salty foods. And then the other thing that we're interested in is the effects of exercise on cardiovascular risk. And exercise is used as a stress reduction type strategy sometimes, but exercise, cardiorespiratory fitness, which is the ability of your cardiovascular system and your lungs to deliver nutrients and oxygen to your tissue so you can exercise, is really predictive of mortality, both cardiovascular related and all-cause mortality. So exercise to increase cardiorespiratory fitness is really important. So kind of in a nutshell, that's what I do. The Center for Cardiovascular Health has lots of investigators that are interested in lots of different things. Some are studying postmenopausal hypertension, others are studying kind of the neurogenic, or the brain effects of dietary salt. Some are studying kids with cardiovascular disease. So we kind of have a whole host of investigators here at UD that are interested in cardiovascular health. So I look forward just to sharing some of the kind of physiologic mechanisms of stress potentially with you. Thanks.
Thank you. How many like salt? Come on. Come on. And I really liked your expression when you said in a nutshell. I was going to say saltless nuts.
There you go.
So you need to add that when you say
I will add that to my
nutshell.
next presentation.
And as you're thinking about your questions for your index card, when you're ready to turn those in, Beth Finkel will come around. She's back there. She just raised her hand, and physical activity, raising hands. So just raise your hand up with your card, then we get your upper body moving too. So a lot of that going on here. Thank you, Dr. Edwards. We're going to be returning to you with some questions about that salt intake and what other alternatives do we have for those who are salt lovers. I hope it's chocolate. Okay. And next we have Dr. Earl Walker. And you see that he comes to us this evening through his work currently at ChristianaCare Health Systems. Thank you for joining us. And I just want to give you a little bit about Dr. Walker's background. He is indeed a licensed psychologist, and he utilizes a performance-based model and wellness approach to enhance the functioning of individuals, groups, teams, and organizations. He has 19 years of clinical experience in the behavioral health field. He's going to tell you about his specialty. He also has over 25 years experience in health and wellness. Welcome.
Thank you. So I didn't plan on standing, but since my other two colleagues did,
We like that physical
I suppose I'll
activity.
do that. I'm really anxious, in a good way, to get to your questions, so I'm going to try to keep this brief, but I want to give you a little history of how I came to become a psychologist and also working with the population of people who were struggling with heart failure. So I started out as a clinical exercise physiologist as well, completely on the physical side, so dealing with below the neck, and really did not like psychology at all. In hindsight, looking back on my transcripts, psychology, that's where my best grades were. But when I went back to grad school, I made a little bit of a transition that kind of introduced me to mental health, and I studied health and wellness. And that's where you hear about the performance model that was developed, and I'll talk a little bit more about that. And then I was introduced to psychology, and here we are today. I worked 15 years in private practice and have been with ChristianaCare for 2 years. I want to say a little bit about the initiative with mental health and behavioral health at ChristianaCare. Across the nation, many hospital systems are integrating behavioral health into their primary care practices and some of their specialty practices. ChristianaCare has actually been at the forefront of that, I'm thankful to say. So I spent a little bit over a year working in primary care practices. So what's that's done is it's incorporated the mind and the body, and that's why we're here today, because we do know that separating them no longer makes sense. It never did, but we're just starting to realize that. So in primary care practice, we came across a lot of issues with mental health in the primary care practice. Physicians just didn't know how to deal with them. So they were prescribing medications. When they introduced mental health professionals such as myself into the practices, we alleviated some of the pressure off of the primary care doctors, but I think we're also able to better treat our patients by having a specialist there to deal with mental health issues. So fast forward to where I am now at the Center for Heart and Vascular. I specifically work in the heart failure clinic. So what does that mean? That's a little bit different. I don't see anyone that, well, I do see some people who have dealt with what we call, heart attacks, what it's generally known as. But specifically, when your heart is no longer pumping efficiently blood or oxygen to the rest of the body, we call that an ejection fraction. When your ejection fraction goes below 50%, some say 55%, that means it's no longer able to pump the blood and oxygen to your heart, then that's considered heart failure. So we kind of deal a little bit with the chicken and the egg. How does anxiety relate to that? Well, people who have higher levels of anxiety are at greater risk for heart failure and other heart diseases. However, people who have dealt with heart failure afterwards also deal with an inordinate amount of anxiety as well. So which one comes first? Well, it's hard to say. So we do know there's a correlation, a strong correlation there. So that's why they've introduced behavioral health professionals such as myself into our specialty clinics. We also have them in our cancer clinics and our women's clinics as well. So that's a little bit about myself, and look forward to your questions.
That's great. Thank you, Dr. Walker. So, Dr. Peterson, I have a question for you. So, as we think about, and actually the other two panelists are welcome to chime in too. I need to forward the slide so Dr. Walker doesn't think we're just focused on his slide.
This is what salt does to you, by the way.
So now we're at the discussion part of the program. I will start out the discussion. We have an hour to have our discussion. So the role that stress plays in the workplace. I was intrigued as you were talking about that effort and reward and the imbalance that could occur. So what if, and kind of thinking about, especially as you're looking for employment, like researching the company's philosophy, and if you can get an indication relative to that. But let's say you're in a work environment and that effort reward is not balanced. How can you produce that for yourself, even if your external environment does not promote that?
Well, that's a good question, and I think a lot of times when you look at different types of economic comes and the kind of the ebb and flow of economics across the country, certain times you don't have that, and in certain types of industries, and even within industries, you will find that there's ebbs and flows within the marketplace, which leads to certain types of things where they can either give you more reward or they don't have the resources to do that, and so you have to actually look within the context of the business itself, because economies come and go. They get strong at times. They go back. They also have issues within even market segments where things will ebb and flow. But when you look at a person who comes into it, and you're in a job and you're in a specific situation where you're putting a lot of effort, and the effort will be high. You'll have a lot that you're working on. You perhaps have long hours. You have these types of things. And the reward, typically, there has to be this kind of, we call this dual balance between what the organization gets as its benefit, but also the individual has to get some kind of benefit out of this too, in order to create a proper environment. Typically, it would come through raises, or to come through bonuses, or to come through certain types of things that way, or recognition, right, for what you're doing. Perhaps you're employee of the month, or you're something along those lines. Awards are given out, or things along those nature. But from a management standpoint, there's lots of things that you could potentially do. But your question is really asking what I can do as an individual. Well, I would quit. No, I'm kidding. But anyways, the idea here is that
I guess he's happy here.
The idea is, though, is you have to figure out some way to reward yourself, and those could be self-imposed. But ultimately, those are going to be short-lived, because you have to be recognized. And Frederick Hertzberg did a lot about this when he looked at recognition in sport in his motivational hygiene theory model, which is that recognition has to be given by the right person at the right time under the right circumstances, right? Otherwise, it doesn't really play. I can go home and my wife can say, "You had a great day at work today. Way to go." Right? But that doesn't have the same meaning as the boss when they say, "You had a great day. You did really well." It means something.
Doing a great job.
That's right.
I feel good. I can go now.
That's
all right. So anyways, but the point being is that type of recognition is needed. But you can do certain things to reward yourself. There is a thing called, and Sister Mahaly writes in his book Flow. He talks about the autotelic personality, and the autotelic personality is a person who creates their own goals and then works towards those. And some of you, if you're not in your heads, you've heard of that before. But essentially, you create your own goals and your own little achievements and your own little internal recognition. But that, in essence, an autotelic personality also has the potential to be most abused, because in the essence, they can be a person that a person continues to put demand upon, and they continue to do things to meet that level, right, till eventually they burn out. So there's a lot of different things you have to kind of weigh on that. So,
thank you. And then I was going to say, isn't there a correlation between feeling stressful and then actually craving salt and chocolate?
That's a segue, by the way.
It's a segue, right? Yeah, so stress increases the risk for cardiovascular disease, and there are some physiologic responses to stress, such as activation of the fight or flight response and some hormonal changes. But then there's also behaviors that happen, and eating is one of those, and that can drive us to eat unhealthy, and some of the increased risks that we get from stress is from some of those lack of exercise, increased eating things that we shouldn't be eating. So some of those things that the American Heart Association says we should do, we don't do very well when we're under stress, like eating a good diet. There's lots of fruit, there's some vegetables over there, so lots of fruit and vegetables in your diet, low sodium diet and so forth. So so stress can kind of hurt us in that way.
And staying on that point too, because we got questions from our audience just now as we were talking about the salt. Can stress actually promote that sodium to be reabsorbed in the kidneys? And
that's a good question. With a healthy kidney, when we eat dietary salt, we should excrete it. So if we were to, and we've done these studies where you feed somebody a high salt diet, we do it for 7 days, for example, we see that their sodium excretion goes up, and our body a healthy kidney is pretty good at getting rid of those. But some of the hormones that get increased during stress, the renin-angiotensin-aldosterone system, aldosterone, causes us to hold on to sodium. So there's the potential that we can hold on to more of that sodium. Along with that sodium comes water, and if you have an increase in plasma volume, that can help drive up blood pressure. So that could potentially contribute to an increase in blood pressure.
Okay.
And if I can add to
Dr.
that.
Walker,
So
please.
in addition to that, stress will elevate your blood pressure. So chronic stress in and of itself is going to impact the blood flow to your kidneys. And that's also going to impact the functioning of your kidneys and your ability to excrete sodium.
Thank you. Okay. Dr. Walker, while you're up, how do you break the cycle of anxiety once you have had that heart attack?
That's a good question, and that takes a lot of time actually, because it's typically a personality type, and you'll find that, at least in my experiences and also in the literature, you'll find that there are people who identify themselves as worriers as early as their teen years, maybe even before then. So the heart attack is usually many, many years after that. And that's not to say there's a direct correlation between the anxiety or the stress and the heart attack, but there is a higher tendency to have heart attacks. You are at greater risk for heart attacks when you're considered a worrier. So that's when you would come to a professional like myself, because there's some beliefs that are held that have to be identified, some underlying beliefs, perhaps some unrealistic expectations. And in some cases, there may be even some trauma in the background that needs to be addressed. And that certainly takes a lot of time. So that's when we really want to refer you to a specialist like myself or someone in the community with the same background, because it will take some time. And we typically set up a schedule. When I say time, let me give you some numbers. So in my mind, I always say in 3 to 6 months, you should see some significant changes. But we set some goals, and hopefully we'll see some changes even weekly. Now, that's not always possible, but we want to kind of keep things time limited.
What role does, for people who are living with anxiety, what role does then pharmaceuticals have relative to supporting people living with anxiety versus how do we do stress reduction and support an individual to limit those anxiety episodes, if you will?
Right. So I used to be someone who, prior to being trained and educated, who was completely against medications. However, I'm going to give you a little different spin on that now. So we have psychopharm medications that will can make you feel any way you like. If you want to feel happy, if you want to feel sad, if you want to feel relaxed. The question is, what is the long-term impact of that? So when we talk about anxiety and the medications that we have to treat that, we have really good medications. The problem is they're habit forming. And I feel like anytime you give someone a quick fix, and sometimes those medications are necessary, especially in acute situations. However, it also makes you less motivated to develop other coping strategies and utilize other interventions. We were talking earlier about one of my favorite interventions is exercise, because if you understand the physiological mechanisms behind anxiety and you understand the impact of exercise, you'll see that that can pretty effectively help you manage stress. I'm not saying that's a cure-all, however, but the side effects of exercise are some soreness when done safely, you know, a little short-term fatigue, but in the long term, pretty good. So our psychopharms for treating anxiety are very powerful and also necessary at times. However, because they're habit forming, we have to be a little careful that we don't utilize or overuse them and not develop those other strategies to cope with stress.
Let's go back to the workplace, and then I'm going back to Salt. So, Mr. Saltman, be ready. Okay, how does an employee know the culture of a company and that their leadership before actually going to work somewhere? What do you look for? Oh, wait, I have more. Would be great for all the, okay, who wrote this? I need some help. Does anybody want to help me out? Okay, I'll try. would be great of all.
Oh, it would be great if all if we had funding. Not all practices have the ability to have practitioners in the office. What are other alternatives for places that do not have nice psychologists like you to help out in either in the workplace or in the primary care office?
I've been called a lot of things. Nice is not one of them. But I appreciate that. Thank you very much. So funding is an issue. In addition, there's a shortage of mental health professionals and behavioral health professionals in the community. So, for example, I'm tasked with working only with our heart failure population and other heart and vascular patients. I have a really difficult time turning down other patients because I know that there's a 3-4 week, sometimes month wait to see a professional in the community. So in addition to the funding, we just have a shortage. We don't have the personnel in the community. Which is why we have to be really targeted with our interventions and very time focused, because there are other people, there's a long waiting list, for example. So I don't have an answer for that. I'm hoping that we can draw more people to the field, perhaps. There's certainly being more attention given to mental health issues. A lot of that's been driven by the military, believe it or not, in the VA situation. So I'm very thankful for that. So the government in general is giving more funding, but the trickle-down effect, we're not always seeing that in our community. So unfortunately, we just need more professionals in the field.
Yeah, to address the cultural side of things, reminds me of a story when I was my first job interview was with Xerox, and I went there and I was just out of my undergrad program and I was looking for a job. It was a sales job to sell copiers, and I sat there in the lobby, and I watched people come and go, and then I watched the interaction of the sales force with the receptionist. And the receptionist, after a few went through and they interacted, she came to me and she just looked over and said, "We have a lot of prima donnas here." and then I went through my first intimidation interview, which was essentially designed to intimidate me after that. And so what ends up happening was they offered me the job the next day, which I said no. But my point being about this is that culture is about the shouldas and oughtas. It's about how they view the nature of people, the nature of human relationships, what's good, what's successful, what's not. So I tell people you need to really look at what's going on in terms of how people interact, how they treat each other, right? Even within your interview process, you should be interviewing and looking and observing constantly. You shouldn't just be going in, I want a job. You should be looking at, are these the type of people I want to work with? I would also look at things such as, remember, when you're being interviewed, what's the hiring process? Well, how are jobs designed? What are the expectations? What is the hiring and firing process? You might want to ask about firing or promotion process.
Oh,
but the idea behind it is those are all the things that are called the mechanisms that reflect the cultural values. And values, as we know within a corporate culture, have to do the nature of human nature. Are people inherently good or are they inherently bad? If you believe that they are inherently bad, you will set up your corporation in a way to control people. If you believe that people are inherently good, you will set your corporation up with your policies, rules, regulations, etc., and management structure in a way to reward people, to give them freedom and opportunity. And so those are some of the things. What you're looking at is what I call the artifacts of a culture. And those artifacts are giving you inklings as to how things really operate. How do people speak with one another? Are people offensive? Are people belittling? Are they berating? Those types of things you will pick up even within conversations that you may have over dinner or things along those lines. All those things should be red flags or precursors to a good job, depending on how they interact. I can remember giving this talk. I used to do a lot of talks on workplace culture and health. And I remember working with a group of nurses. And I said, and this doesn't really address your question directly in the sense of before the job. I asked them, how do you know the culture of your organization? And I said, it's typically the way that you experience it the first day. When someone shows you around and they go, this is so-and-so, be careful of them, right? This is so-and-so, and here's the keys to the executive washroom, right? And how big your office space is and where you are and how decisions are made and who you have to get approvals for and all this kind of thing. They show you around and kind of give you the lay of the land. They are introducing you to the corporate culture. So anyway, I asked, what's the culture of nursing? And I can remember this. We were over in the DuPont Country Club, and I was there. And this nurse, she'd been around. She could tell she'd been through everything. And I said, how would you define it? And she just stood up and she said, we eat our own.
Yes.
There's culture.
And I said, yeah, well, that kind of explains it, you know. and you talk about nursing, and that was, you know, you being a nurse, right? The idea behind this is that the way they treat nurses the first day is kind of like, whoa, you know, it's kind of like you will be cleaning out the bedpans down in the basement, you know, kind of thing.
We worked on getting better over the years.
Yeah, they have.
Yes.
Because in fact, a lot of the research early on came out of nursing journals, right? Because they understood that it was an issue and a problem that they had to address. And so, anyways, but beforehand, you need to really be awake and keep your eyes open to every interaction, how people do and they treat each other, right? So.
But you're sure you're advocating having a spy bot in where you work?
I would wear a camera.
Yeah, like there's nanny cams. So
I have a question
Dr.
for the audience,
Walker.
if I could. I just want to ask the audience, how many of you get 8 hours of sleep per day?
All right, the sleep question. Yeah. Oh, nice. Oh,
8 hours
nice.
of sleep.
Yeah.
Oh, that's
So
great.
if you divide the 24-hour day into thirds, you get 8 hours, and 3 8-hour blocks. If you're getting 8 hours of sleep, how many of you are employed?
That are getting the 8 hours of sleep.
Okay, so we have another 8 hours that's dedicated. I want to stress the importance of a healthy work environment. So if you work your typical 40-hour work week, you need at least 8 hours for your work, right? But how many of you live at your jobs? I know you probably feel that way, right? Right?
Are you sleeping on the job because you got 8 hours?
Right? But you do commute there, right? So our work lives take more than 8 hours because we have to commute there, we have to prepare to get there, commute, and then we have to commute back. So now we're typically looking at least 10 hours. That's if you're only at your work site for 8 hours. So now we're looking at 10 hours. So more than a third of your day is at work. Now, how many of you only work a 40-hour work week? You're very lucky. Where do you work? I have an application and a resume. All right. So now we're looking at maybe closer to 12 hours per day. So now what's left in your day? We have 4 hours left to eat healthy, low sodium, right? McDonald's doesn't serve low sodium. Wawa doesn't serve low sodium. Well, I'm just going to get a healthy turkey sub. Processed meat, high sodium, right? So, but I don't have time. I have 4 hours. And I have to get to the gym because these crazy doctors up here said I should exercise, right? So I got to squeeze that in. I got to make sure my kids get their homework done. I got to take my medications if you have them. If you're at my age, you probably have to do that, right? And then how about the time that you actually spend with your family? Spouses, children, quality time. I haven't seen my son today. My 15-year-old son was up at school before I was out of my bedroom. Do you see where I'm going with this? So we spend most of our work day, most of our days at work surrounded by our coworkers. And if that environment is unhealthy, think of the stress that that adds to you. And then we tend to bring that home. Does that make sense?
The one thing I want to piggyback off that was the commute. I did a study out in California, and I remember getting a follow-up message. I don't know how it was, but this woman wrote to me, and because I was the objective outside researcher, and I don't know how I got it. I can't remember how it was, and it wasn't a violation of, I call it IRB or this kind of stuff, because I don't know who it was. But the point was, is they said, I'm crying. I pulled over on the side of the highway. I'm crying because I can't take it anymore. And her commute was 2 hours each way. And if you've ever, I lived in Southern California for 7 years, and basically the commute, it's even worse now than when I was there. But the commute was horrendous. And it was 2 hours each way for her for a job. And so you add on to the 8 hours that she had to be there, plus the 2 hour commute. And it's not a nice leisurely drive through the countryside.
Right.
It's a high stress, oftentimes going 5 miles an hour on the 205, right? And you're literally, you don't have, and so she just had to pull over because for whatever reason, I was the recipient of the concern. She needed to vent to somebody or talk to someone, but I don't know how it came to her. I think that it circulated because they had an email address for me as if they had questions, and I think that's how it was. So anyway, so the point being is that, to piggyback off what Earl said, is that, yeah, you got your 8 hour day, but then you've got preparation. But if you have a long commute, and I know here on the East Coast it's the same thing. If you live in Philly, But even going from Middletown to here can be quite a commute, right? And you kind of do your day to try to reduce your stress level, those types of things. It's all part of what I call how do you manage the entire work environment over the day? Because all these things add up over time, creating a lot of physiological distress, emotional distress, right? Mental distress, right? That you have to you're all negotiating that. And that's one of the issues. So anyways.
And I also know that in today's world, we have things like this that keep us connected all the time. And, many times, even though we might not be putting in the official hours relative to work, we put that on us, even in our home environment, to continue to do our work and have challenges relative to really shutting it down and giving our bodies a chance to rest and sleep. I know they even say that don't take your devices to bed, like don't have them at the bedstand. Don't do that, because you will, first the light that is associated, but also then the indication to constantly, I even keep mine downstairs, but if I wake up in the middle of the night, you betcha I go right downstairs to sleep. And it's habit forming. So some of these things we kind of impose on ourselves relative to stress reduction.
I just
Dr.
wanted
Edwards.
to, the way Dr. Walker started is talking about sleep, and now there's a lot of evidence that adequate sleep, or a lack of adequate sleep, is a risk factor for cardiovascular disease in and of itself. Yes. So getting adequate sleep is really, really important. So if there's something that's keeping you from that, figuring that out is important.
And while you're still up, I have a salt issue. I actually
not
do
a question
have a
anymore,
salt
it's
issue.
an issue.
The what? So, and this is someone who has a practice, and I probably won't do this justice, so I'm going to try to paraphrase it, but please don't hesitate to stand up and shout it out if I get it not right. But in this practice, I treat a lot of adolescents with chronic headaches and dizziness, and they're recommending 1 gram or more of salt daily. Do you think there are any long-term negative effects from increasing salt at this age? Does that individual want to add more to this? Is it? Yes. Was that good?
Yeah, right. So, yeah, I know that. Yeah. So it's always there's always this kind of back and forth that happens whenever you talk about the deleterious effects of salt. There are instances where salt's a good thing, where you have to. So POTS is an example. So orthostatic hypotension and so forth. So you take the salt in to help increase plasma volume and maintain blood pressure. So that so in that case, it's beneficial. And I don't know if there's any studies that looked at the long-term effects in those kids. Or even young adults and older adults who have that condition and need a lot of salt to maintain that. And there's also athletes, of course, that need to eat to replace the sodium that they sweat out and so forth. So all that has to be taken into the context. But for the general population, in general, we eat too much salt. But there
so it sounds like you're good. Good protocol. But could be interesting from a research perspective relative to any long-term impacts from that protocol in adolescents. Speaking of adolescents, while we're on that topic, I saw in the New York Times, I think it was just this month, that the anxiety now relative to our adolescent population seems to have increased. And also, I believe now the age of diagnosis may even be earlier age than was before. Do any of the panelists want to kind of give your perspective as to what might be occurring in our children and adolescent?
Sure. So some research that I'm familiar with, and this was on university campuses across the nation about 10 to 15 years ago, we began recognizing a trend of an increase in depression and anxiety on campuses. About 10 years ago, we thought, wow, this is continuing. We really need to begin to address this. They've probably done the same here at University of Delaware. So that kind of triggered people accessing counseling centers more frequently and being diagnosed with anxiety and depression at higher rates. That kind of triggered an awareness, I think, across, nationally, and we certainly are seeing that in adolescents. We have some recent research that are actually showing in our adolescents the impact of social media on rates of anxiety and depression. So not to pick, and this is very early research, so I want to be clear about that, so we're going to look for more oncoming research. But for some reason, Instagram is apparently more harmful than the other elements of social media. You guys are maybe more familiar with it and the intricacies and differences between the two. And specifically, there's some gender differences. It's affecting, in a negative way, females more than males. For some reason, males tend to use YouTube more, and just watching movies and videos. They don't use social media in the same way. So this is some very early research. In addition to that, I think there's something in our culture, I think we talked about this a little bit earlier, there's something in our culture, I call it the pace. There's a certain rhythm to our lives. There's a pace to it. And I don't know if you've noticed this over the last 20 years, if you've lived that long or even beyond, the pace of life is so much greater now. So when we have parents who are working 12 hours per day, rushing home to cart their kids off because we want to get them involved and keep them engaged in things, I want you to imagine the experience of a child when mommy or daddy rushes home, throws some food onto the table, and then says, get in the car, come on, we gotta go. Well, here's the problem with that. The normal development of children, they're not efficient with time. That's just how it works. Kids get distracted. This is without any diagnosis of attention deficit disorder or anything. Kids fall down, kids forget things. Oh, my soccer cleats are upstairs, I forgot. You're already 5 miles into your trip. We gotta go back. And parents say, we don't have room for error, in other words. Guess what children need? Room for error. So I suspect that this culture is just not really healthy for children. In addition to that, we know that there are two things that really impact the social and emotional development of children. The existence of a routine, we call that safety and security. In a child's mind, from their viewpoint, that's a routine. That's knowing that tomorrow's going to look pretty much like today. That's calming to the emotional system of a child. And unconditional love. That means even though I forgot my cleats and we're 5 miles down the road, mommy and daddy are still going to love me. And it doesn't mean that, well, I love you, but the child has to feel that. It's in their perspective. Some of those things are missing. So from a child's viewpoint, they're kind of on edge. Their emotional system is rattled. We're constantly on the go. Come on, hurry up, get in the car, we gotta go, I don't have time. That's not healthy for children because guess what? They need time.
I love that room for error. Can adults have that too?
Well, believe it or not, the difference is the needs of children and adults are the same.
Yes.
Isn't that interesting? I know we're so much different and advanced, but guess what? Our basic needs are the same.
That's right. I think we have a question in the back, and then we'll come back.
I just wanted to sort of touch on that. So I know as parents, we all feel that. I'm looking here and watching everybody shaking their head, yes, even students included, that they feel that faster pace of life and everything just seems so crunched all the time. And I think we all know that we need to eat healthy, and we all know that we need to work out more, and we all know that we need to be more patient. But can you guys provide tangible tips to actually help us with those things? Even just, here's one thing I can do today to let my child know that I'm calm for them. Or here's one thing that, I can do for my spouse or even my coworkers, because we kind of feed off that negative energy within our offices as well. So are there any sort of tangible, short techniques people can use?
And we'd like to have that to each of you from your perspective. So we'll start with Mike.
Well, I wanted to piggyback a little bit on what Earl said. We did a pilot study here among college students of how technology and stress kind of were related in terms of their social interactions. And we picked on things such as, you had a difficulty with a professor, how would you do it, or a roommate, or things along those lines. What was really interesting was it really came down to time and space. Because when you look at social media, right? And you look at our cell phone, and we asked, would you prefer phone, face-to-face, email? Well, if you look at those, each of those is certain degrees of time and space. When I am sitting here, we are in the same time and space. This is the best way to connect, because I can see you, we're in the same location, we're in the same time. When you go to a phone call, you are in the same time, but you are not in the same space. You are 1 degree removed from the person. When you go to your social media, when you have your cell phone and your text or your email, you are no longer in the same space, and you no longer in the same time. So you are 2 dimensions removed. And so what ends up happening is that our young people are relying more on technology in order to interact and to communicate. In fact, I was reading in the news, kind of scanning the headlights, where they said 70% of teenagers today prefer to talk to people via email or text or whatever it might be, which is shocking to me. You know, I just go, that's a problem. So one of the things is, and then you look at the problem, which is, what is the number one problem among young people today? Loneliness. That's the number one problem. So you start looking at those things, and that has the same types of problems on cardiovascular function and other types of things because of the anxiety created by that. So coming back to your question, Ryan, which is some tips, which is some of the things I say is that you really have to start, we have to start looking at this problem of the use of technology. Number one, today in a class I was reviewing a faculty member, watching them teach. This one student could not get away from surfing the internet. She would go back and forth, back and forth, back and forth. It was an hour and 15-minute class. She checked her Instagram. She looked at her Facebook. She went and looked at the PowerPoint that was up there. Then she went back and surfed the internet. She went back to send a text message. And I was watching this, right, while the person 2 rows down from me was taking a selfie in class, right? I was going to photobomb them just for fun, you know, right? And so I told the instructor, we debriefed afterwards to kind of talk about this and how do you handle attention management. It's not classroom management, it's attention management. So anyway, so the point is that creating these environments, one of the things that's happening to reconnect, and this is something that young people are doing naturally, is reconnecting with nature. Believe it or not, there's actually a back to nature movement among young people. And I think there's a lot to be said about taking people, your kids on walks, reconnecting with them, doing things outdoors, those types of things, because it removes technology from the scenario, but it also creates authentic experiences where you interact. And by doing that, it actually is a useful distraction to get away from focusing on the anxiety and the stresses that you're dealing with. So those are some things that I would say.
It's almost like you have to retrain people to bring them back, where, you know, in my generation, you didn't have all that, so it was just natural behavior. But now with all the attention grabbing, if you will, you know, even in a classroom environment, it becomes almost like a habit to, you know, check or surf the net or things along those lines. So, you know, some of this is how do we retrain that behavior in that brain to kind of live in the moment and be present in that moment. I think, Dr. Edwards, you had some comments as well.
Yeah, I mean, I guess I'll approach this from one of the things that gets squeezed out of everybody's day is exercise, right? Because it's something that if something's going to go, that's what's going to go. We have Google Calendars, and everybody has a calendar. So one strategy is to schedule your exercise. It's on your calendar, so don't let anybody schedule during that time. And it's tough to do, but you just have to kind of hold strong to that. From a kid's perspective, you know, I was still exercising. It was becoming, I know I need to exercise, I need to know to do this. Mm-hmm. But I did a 5K with my son, who's 12 years old. And running with a kid is like, they just run. They love it, right?
It's running.
So it kind of like, you know, I was like, wow, I love running too. So it kind of like re-energized me. So doing those things with your kids can kind of re-energize your wants or needs to do exercise because it becomes fun again. It's not something I have to do just because I want to stay healthy. It's actually like running.
And you're with your child.
And you're with your child. So,
extra bonus.
You know, trying to schedule your exercise. There are also some, you know, kind of innovative ways to reduce the amount of time that you need for exercise. These high intensity interval training type programs that can reduce the time a little bit and maybe more enjoyable for some folks. Mm-hmm. So, you know, the trainers at the YMCA or wherever you exercise can help you with those types of programs that might help squeeze a little bit more benefit into the limited time that you do have to schedule for your exercise.
And Dr. Walker, I know you have some tools in the tool chest.
Yeah, just in general, to the parents, I have 2 teenagers. One likes to hang out with me, the other one doesn't. So when I go home, I have some options. I can watch television, I can surf the web, I can check my work email, or I can hang out with my son. We can go exercise, which is what I plan on doing. My point is this: if you have children, and especially teenagers, and you have one that enjoys spending time with you, that is so much fun. That is way more fun than surfing the web, checking my work email. So we have to find those opportunities to do that and really take advantage of that. And I think our children really appreciate that quality time. Now, from a practical standpoint, because this is very difficult, and working with families and patients, here's what I say, and this is a challenge. This is a challenge, but I'm going to ask you the same thing. Children have 4 basic needs. Adults have the same 4 basic needs. I'm going to give them to you. I'm not going to quiz you. It's a little late. We don't want to be challenged too much this late in the day. Food and all the life-sustaining elements. Shelter. Safety and security. And love. Okay? Notice what's absent from that list. iPods, iPhones, Galaxies. I don't even know what else is out there nowadays. I don't understand it. So there's no electronics on that. This goes for adults too. We've trained ourselves to believe that these gadgets that we carry around with us are necessary. That's an incredibly unhealthy message to send to our children, but it's also unhealthy for us as adults. So we can model better behaviors by getting back to the basics. So when I work with parents, I share with them, what are you willing to give up to improve your quality of life? I'm going to give you those 4 basic needs. Everything else is extra. Now we got some real work to do. And my work is convincing them that all those other things that they have are truly unnecessary. Unless we're willing to give up some of these things that really don't add to our quality of lives, even though we think they do, then it's really a tough task. But then I ask a parent to think about the consequences, the impact that it has on their children and that relationship. So what are you willing to give up? So I live in Middletown. I actually grew up there when it was all cornfields. When a 3-bedroom, 1.5-bath house was, I don't even know if that was the norm, but you were kind of certainly satisfied with it, but you may just have a 2-bedroom. Now we have 4, 5-bedroom, 2.5-bath with finished basements. Well, guess what that creates? More pressure on mom and dad to work. And guess what? We live in Delaware. So maybe I'll live in Delaware with a lower cost of living, but I'm going to work in New York, DC, Philadelphia, so I can make more money. But now that increases that work part of my day and decreases the time at home. So I say, are you willing to move closer to your job? Or are you willing to downsize? I have rooms that I never see, ever, in my house. Do I really need that? These are tough questions, so it's not easy, but if we want to improve our quality of lives and reduce our anxiety, guess what? We have to make some tough decisions. We can move closer to our jobs, and we say, well, the school district in Middletown's better. I don't want to move closer to my job. What's more important? The Middletown School District was horrible when I went there. I did okay. My parents got home at a routine hour and spent time with me.
So you're saying as a culture, we need to kind of pause,
shift our priorities a little bit and refocus. So we bring a lot of this on ourselves, quite honestly.
Do you see then that direct correlation possibly between the increase in the anxiety in our children and adolescent that has been now documented based on us as a culture? What I'm hearing is we're fast-paced. We have traded in this from a dimensional, as you were talking, Dr. Peterson. We are further removed from each other in a way that we enhance our relationships, our connectiveness, if you will. And so kind of have lost some of those basic needs that we all strive for.
Absolutely.
From a focus perspective. Is there something, because that's impact our entire populations, not just Delaware based. It's actually the U.S.
Nationwide.
culture, right? Is there something then that we can do to start shifting that and preventing what now we are seeing, because it's doing harm to adults, and now it is actually doing harm to our children?
Well, I think we have to recognize the impact of some of social media and television. We are bombarded with marketing that tells us we need things. And there are some things that just look so cool that we have to have them. And that's what we tell ourselves. And that's the intention of good marketing, is to make us feel like we have to have it. So in doing that, I may not have the money, but I have a credit card. But now to pay off that credit card, I got to pick up some extra hours.
But how do we reverse that? How do we market the other? Because I know, Dr. Peterson, you're like well versed in health promotion. How do we take this conversation if we believe that is causing, which I do?
Well, one of the things is you know, I did a big study on work stress in America, and I actually read, and most people don't read Alexis de Tocqueville's Democracy in America, but I actually looked at that and looked at American culture and trying to understand how we as a nation, our own culture, contributes to workplace stress, or in stress in general. And the interesting thing is that we as Americans actually both seek it and fear it simultaneously. Alexis de Tocqueville wrote about how Americans would go on vacation, but they would go as far as possible and basically work the entire time to come back to say, I had a great vacation. Right. Where Europeans would say, we're just going to go lay out at a spa for a while, right? But we have to go, I've got to go here and here and here and here, and I come back and I'm overly tired from my vacation. The other thing is to try to accomplish as much as possible in as little time as possible, right? As much as possible in as little time as you can to get there, to get your kids in the best school, the best preschool, the best nursery, right? All the way through to get them up to where they need to be. Well, the impact on kids is that they learn this expectation that now I have to be the best, I have to do this, and they can't actually be themselves, right? I've talked a lot to my students because the issue about them is that they feel the expectation is there. They get nervous about what they have to be and how much they have to do, and it's increased over time. I've been teaching in higher education for 30 years. This is my 30th year. But the idea is that they've changed over time. Before it was like, oh, I went to school and off I went and did something, I'll figure it out later. You know, not too concerned about this or that. Now it's literally, there's lots of pressure on these kids today, plus debt, plus other things that they have that create this. But the issue is that when you look at this, it's about being an individual. And Earl and I were talking about this earlier, about stop being the brick, like conforming to what culture is trying to tell you to do. What is it that you are going to be, and make your own way. Right, and not have these expectations of what everyone else is telling you should or should not be. Social media actually drives that. It actually is conforming. It actually says you need to be a certain way. And kids are trying to basically conform to whatever it is that's popular, the expectations that are there. This creates a lot of stress and anxiety. And when you say, stop worrying about what other people think about you, stop comparing yourself with yourself. And a lot of this is, we look at this, there's fundamentally even within the United States and within many parts of Christendom, you have things such as the health wealth doctrine. That, in other words, if I am healthy and wealthy, therefore I am somehow better and blessed. Right? Well, if you know that through life, things aren't necessarily like that. And that actually leads people to feel the additional pressure of, I'm not measuring up, I'm not doing this in many different ways. Right? And that creates additional stress and these type of things. Other than life happens, let's help each other out, you know, and do those things that are necessary. I mean, it's very deep and it gets into lots of things. That's why I began exploring it and looking at it at multi-dimensional levels, because I wasn't satisfied with just looking at it at this level. But you look at this, our American culture, it has many benefits to it. Don't get me wrong. There's many good things about what we've done here. But there also is what we call anthropological medicine, or medical anthropology, which is that each culture has its own unique problems. Where ours, in the 1920s, cardiovascular surgeons were talking about the predisposition of Americans to angina, right? And that was because of essentially the cultural expectations that we had about accomplishing as much as possible in as little time as we could, right? It's sort of like at the end, the one with the most toys wins, right? Well, that kind of beats people down, and they begin to lose the things that Earl was talking about, which is the connections of the loving relationships and things like that. And that's actually what people are looking for, right? And you're seeing that as an antidote for what's happening. However, the technology is drifting that apart because the dimensional separation that happens there. Yeah.
Can I expand upon something about loss of our loving relationships? So I want you to think about a trauma, if you will, and loss of a spouse to death. That's pretty high on a stress scale, right? So how do you eventually overcome that level of abandonment and those conflicts that many times that level of loss has on the grieving spouse, or even the grieving parent who has lost the child, some traumatic, life-altering event, and the anxiety that goes along with that?
Very, very complicated question, and I think a very important one as well. When we talk about some healthy and unhealthy things in American culture, one of them is we have many unrealistic expectations, and I'll get around to the grieving part, but we have many unrealistic expectations. There's a really good book called The Happiness Trap, written by a gentleman, a psychologist from Australia, and he talks about in America we have this expectation that we're supposed to be happy all the time. I think, not to get back to social media, but I think that also promotes that idea. And the reality of it is, from a health and wellness perspective, a healthy human being is able to express the full range of emotions when appropriate. Grieving would be appropriate if you lose a spouse or a loved one. I don't like to put a time frame on normal grieving, so to speak, because I think it's individual. But there is a process that you can go through, and I think you can also get help to go through that process from a professional like myself as well. I think the important thing is that you're moving through it, and it can be at your own pace. So having said that, I think we can prepare ourselves a little bit better. As parents, as educators, we can prepare our youth better to understand that death and dying is a part of life. We can prepare them for that. We can stop protecting them from that. We can bring them to funerals so they can prepare and understand kind of the circle of life. We can talk to them about it from a Disney movie perspective. We can take them to see The Lion King and talk about it. But if we introduce these types of things that are really a part of life earlier and normalize them, I think we're better prepared, and it gives us not only the language to discuss them, but it also gives us an opportunity to develop healthier coping strategies to deal with them. I think right now our expectation is that we should be happy all the time, we should live forever, and we should not lose any of our loved ones.
Can one of you also address, I've heard people who've had anxiety and maybe for the first time had that level of anxiety and almost feel as though they are indeed having a heart attack. Is there any way that you, as a lay person, can distinguish between the two, and is it dangerous to do so?
I'll let you go.
An anxiety attack, if you want to call it that, rapid heart rate, they may sweat, and they, very similar, they may get short of breath, very similar to the symptoms you might get if you thought you were having a heart attack. And you're always better erring on the side of getting help. If you start to have any symptoms, chest pain, jaw pain, back pain, shortness of breath, rapid heart rate, those types of things, you really want to get help and not say, oh, I think I'm having an anxiety attack and kind of blow it off. You're always better off getting it checked out and being told, no, it was an anxiety attack. That would be my recommendation.
That's the recommendation.
Yeah.
Sometimes they can indeed mirror each other.
Yeah. There's no way to distinguish between the two from a layperson's perspective. You need to go in, usually to the ER. Even if you go to your primary care physician, they're usually going to send you to the ER so they can do more extensive testing. But the symptoms are so similar that you just want to err on the side of safety. Certainly there's greater risk factors. Certainly if you're my age, you definitely go in. If you're 14, does that mean you aren't going to have it's definitely a panic attack rather than, no, still not for sure. But my risk, of course, is greater because of my age. If you have any history of any cardiac events, your risk is greater. But I would say, Similarly, I would agree. We just don't take that risk. It's just not possible to, without more extensive testing, to determine that.
Okay. And Dr. Peterson, when you talked about the effort and reward and that imbalance, can you tell us more about the demand and the control?
Yeah, the demand and control balance is, if you really look at any job, you have certain types of things that are demanded of you. We'll call them your job responsibilities, all right? And that can be based, here's what you're supposed to do, here's what your job description is, here's what you were hired to do. It also has to do with the time frame in which something may need to be done, or the expectations of done. The control part is basically, do you have the ability to control how you do the work and how you do the demand? Is someone else dictating how you do your job, right? Or is someone dictating when it's due, right? When it has to be done? Like, for example, if you were a secretary or an administrative assistant and your boss comes to you at 3 o'clock in the afternoon and says, I need this report all written up and drawn up and it needs to be done by tomorrow morning. Well, you had no time, it's an increased demand, and that's why jobs that have high demand, low control, which are typically those types of assistant jobs, right, can be highly distressful for people. And so the notion is trying to get that, to create the ability for people who are in jobs to be able to do the work the way they need to get it done and have the control to be able to do it how they would like to and within the time frame that's reasonable. Now, I understand we all have demands and other people need things at times. That's normal. What I'm talking about, for example, if you are micromanaged, I call it the kiss of death. Because it essentially takes high demand and they're taking all the control away from you. In a person who is micromanaged, the literature is quite clear. They become basically infantilized, right? They become more like a child, and they will not seek, they'll say, how should I do this? So you could have someone in their 50s who's been working forever, and they'll go up to someone and they'll ask them, how do you want this done? What do you want done? That kind of thing. And those are signs, by the way, I tell managers, those are signs you're micromanaging too much, right? Now, there's times when you want clarification, so you can sort of sense that. That's different. But if people can't make a decision without you, right, then that's a problem. I can remember a story of, it was a health insurance company up in Connecticut, actually New Hampshire, and they had an office party. And at the office party, all the workers were coming up to the boss and asking for approvals for this and approvals for that and approvals for this, and that was kind of stuff. And it was essentially that particular manager was controlling everything and not allowing anything to go forward without them. Well, in one sense, it's good job security for them, but it was creating such distress for the workplace because they couldn't do anything. They were all like, is he going to be in? Is he going to be in? Can I get approval? Can I get approval? And so essentially what happens is that people get anxious and anxiety over, I've got this responsibility, but I have no way to move it forward. And so those are things, though, when you work in a company, you try to say, okay, now what's doing? Let's take a look at this. How, it's about the art of delegating. And with delegation, it's not just the job, it's also the control to do the job. And when you do that, the freedom, oftentimes you give people enough, and oftentimes you can be quite surprised. Other times it's just like, okay, maybe we won't give you so much next time. But anyways, the point is that people learn, and there's a learning curve, and you have to go back to the point of, for adults, you made this at the very beginning, is the ability, the freedom to make some errors and make some mistakes. They learn from their mistakes, and they actually come out and do better.
Absolutely.
So, Dr. Edwards, I'm going to give this one to you.
Okay.
So, the American Heart Association reported recently that heart disease has declined by 33% in America. What can we attribute to this decline?
Yeah, and I think what you're referring to is that deaths from heart disease have been reduced. So heart disease is still the number one killer.
I thought so. The number one killer in women.
Yeah, both men and women. You can attribute the reduction in deaths due to the advances in pharmaceuticals and devices and so forth, and treatments that are available, but it also means that folks are living longer with cardiovascular disease. More of them will have heart failure, which are the patient group that Dr. Walker works with, and so forth. So there's still much to do in the area of heart disease and understanding the best treatments and reducing risk. But a lot of it is shifting to prevention. We really need to prevent the development of disease so that we don't have to manage as many people that have it.
So you're
later
going
in
back
life.
to SALT, aren't you?
No, the American Heart Association has their Simple 7, and a diet is just one of those.
Okay.
But there are many other things that are important.
So as we were talking about the number one killer of women, can you also touch upon a heart attack in a woman looks different than a heart attack in a man, or could look different?
It could look different.
The signs.
Yeah, the signs may be different. They may not have a typical chest pain that a man would have. I'll give you 2 examples. My parents both ended up with, I don't have good family history, I guess. So my mother's pain was kind of this dull jaw pain that she had, right? It wasn't, the typical chest pain. My dad had classic angina. So those symptoms are not necessarily, just because you're not having typical, crushing chest pain doesn't mean that you may not be having symptoms of heart disease. Shortness of breath, dull pain, something that just kind of, nags at you, doesn't go away, may be a sign that something's happening and you should get it checked out. And also, happens a little bit later in women, because of the transition to menopause. So, the risk is very high in women once they reach menopause, and actually exceeds that in men if you compare the ages past that point. So, heart disease is the number one killer in both men and women, and we really need to be educated about that. A lot of other diseases get a lot of press, but heart disease is still a big problem.
Dr. Peterson.
Yeah, I was going to add too that there are gender differences in terms of even the stress response. And there's also, in terms of the workplace, I did a national study here looking at gender differences in the workplace. And it was interesting what men and women value. They value the same things, but in different orders. And it has a lot to do with what you want to do in terms of how you look for a job, but also in terms of things of what you might want to consider in terms of interventions of how you decrease stress or improve the productivity of both men and women in the workplace. But ultimately, just the differences in response. And this is a lot of work that Shelley Taylor did out at UCLA. And this is, for women, it's tend and befriend, right? Whereas for men, it tends to be more fight or in flight. And these types of things are differences. I always say, how do you know this? Well, differences between a husband and wife when they come home, right? When they get, women tend to want to talk about something, right? I want to talk to you about what's going on and what's going on. So it's this relationship issue. Guys are like, humph, and they get angry, or they get upset, or they got to exercise or something like this to work it out. But women will want to talk, right? And it's about this relationship. And Shelley Taylor's done a lot of work in this in terms of in her research. But in my study, we looked at the difference of what men and women value. Well, number one, by far, anything that women wanted in the workplace was relationships. Number one, and collaboration and communication, right? Duh. Right? Guys, it's more about, number one was pay, money, right?
To be a provider.
And yeah, exactly. And to do those things. And it's a classic Mars-Venus study, but it was the point being is that we oftentimes don't look at those issues as it relates to the workplace and how it affects workplace stress and how you might want to manage women differently than men. It's not that I call it bell-shaped curves. There's outliers on either end, but generally speaking, you have to understand the nature of your workforce and how to best manage them if you really want to make a health promotion effort to improve stress and reduce cardiovascular disease and the effects of it.
Well, before we close, actually we're coming to the end of our time together in conversation. Just any final short comments, Dr. Walker?
Sure. Just bringing more awareness to how you're feeling, your anxiety levels is really important. Monitoring them is critically important. I want to share a brief story just to highlight the importance of your mental health and your anxiety levels and even depressive symptoms, things like that. So everyone's familiar with 911 and where they were at that time. I had an undergraduate classmate who I was pretty sure told me he worked at the World Trade Centers on that day. I didn't know at that time that cell phone towers could get blocked if everyone's calling, and obviously everyone was calling. So I didn't get in touch with him until about noon on that day. And he picked up the phone and kind of in a panic, I said, are you okay? Well, clearly he picked up the phone, and this is what anxiety does to you, right? It impacts your ability to think. Well, clearly he picked up the phone, so he was okay. he said, yeah, I'm okay. I said, what are you doing? He said, I'm sitting here watching television just like you are, watching the news. And I said, don't you work at the World Trade Center? He said, yep. I said, but you're okay. He said, yeah, I'm okay. I said, what happened? He said, I took a mental health day.
Wow.
He said, I was feeling stressed, and I just said, I'm going to take a mental health day. So as Americans, we tend to save up our vacation for that beautiful stretch in the summer, but guess when stress hits us? Throughout the year. And it's important to recognize it. So it literally can save your life by just simply being aware of that and learning to take breaks, right? So I want to thank you for having me here. If you have any more questions afterwards, please feel free to come and ask.
Thank you. And Dr. Edwards, any final comments on anxiety health and cardiovascular health?
Well, I think it's just important to understand that stress and anxiety can increase your risk for cardiovascular disease. And then also understand the things that in general that increase your risk. And when you have your annual physicals, ask for your blood pressure, cholesterol, blood glucose to be checked, and so forth.
Know your numbers.
Know your numbers, right? Know those types of things. And then make time for your health. Make time for exercise, make time for those things, and schedule those things in. Because it's important. We make time for lots of other people. Make some time for yourself.
Thank you, Dr. Edwards. And Dr. Peterson, any final comments?
I have a lot, but I'll be real brief. When you look at work stress is normal. It's not that it doesn't happen and that you're never going to have a stress-free environment. It's not going to happen. It's always going to be there. Some people are going to contribute to it. Other people will help alleviate it, and all sorts of things that are there. But the other thing is to also put work within the perspective of your life, right? And is it do you work to live or do you live to work? And I think that's some of the things that a lot of people get mixed up in their pursuit of whatever the American dream is. They're trying to get as much as possible in the shortest time, as we said. But the point is that what's really of value. And a lot of times when we work with people, and I used to do programs in worksite health promotion of helping people just prioritize what's really important to you. And you mentioned about death, and I said oftentimes I had this exercise where I say, what do you want people to remember you most as when you die? And how much of your time are you actually contributing to that in your life? Is it appropriate? And it's an interesting reflection exercise. Because a lot of times people go, wow, I am really spending too much on work and not enough with my family, or these pursuits that I wish I could have done. And then you get to later on in life and you said, boy, my life is I've done all these things, and now what? So anyways, and it's just something to think about. So put work in the perspective, in a broader perspective.
I'm hearing a lot about focus, getting back to those basic needs, whether it's with you and your children or just for you, and really what is meaningful and authentic, even amongst all the noise that we as a culture have actually perpetrated out there. So how about if we give our panel a round of applause? I think it's been terrific conversations, and again, we will be continuing our conversations on healthcare, well-being, and prevention. The next one up is December the 5th, and that is on a patient-centered comprehensive healthcare team that really focuses on us as the consumers of healthcare. Thank you, everyone, for joining us.